What's up, everyone? It's Michael here at Home Health Success Academy. So, welcome to another one of our training videos to be able to help your home care, your hospice, your home health agency become successful. And how do you guys become successful? Well, first of all, you may have great clinicians, you may have great therapists, you may have an amazing receptionist, great director of nursing, but guess what? If you guys cannot bring in the patients, all right, if you cannot bring in the clients, the referrals, how can you prove how amazing your services are? So our goal here at Home Health Success Academy is to be able to help you guys create an amazing company by making sure that you have patients coming in. So that what? Everybody gets paid. So that what? Everybody is happy. Okay? So in this quick video, what we're going to be doing is we're going to share with you guys the five. That's right, the five biggest mistakes made by marketers, by companies when they are actually presenting, and five of the biggest reasons why you do not get that referral when you do a presentation. So, problem number one, for example, out of the five, is literally this: you forgot to ask for a referral. How many times have you ever done a presentation and you actually forgot to ask for the referral? Now, some people say, well, they said they're going to refer to us, or they said something like, you know what, the next patient that comes up, we're going to call you. Or the doctor says, you know what, leave your brochures and we'll make sure that we have your information. So if we have a patient that needs the services, we're going to call you. Some people are going to say this: great presentation. Thank you so much for the food. We appreciate everything. We look forward to working with you. Or one of my favorites is this one: we don't have any patients right now, but guess what? When we do have a patient, when I feel that they do need your services, one of my staff members will definitely give you guys a call. Those are just some of the biggest things that people say, and some of the marketers out there, some of the director of nursing or administrators that go out there and does presentations to try to be able to promote their company, they hear this and in their head they're like, we're going to get referrals. Yet 1 month passes, 2 months passes, 3 months passes, and guess what? No referrals. You need to be the one to ask for the referral. If they are going to say that they're going to start referring to you without you even saying or asking for it, most of the time that's what we call in the marketing world, in what I do, as what we call an objection. It's for them to be able to make themselves feel better that they took some of your time, but at the same time as they didn't make any commitment. Okay, you need to bring up the objections. You need to be able to ask for the referral, and ask for the referral constantly. Don't wait till the last minute of the presentation. Ask throughout. And this is where we need to be able to stack 5 to 6 different closing scripts into your whole presentation to be able to make yourself stand out. Doctor, in the beginning, doctor, between the scale of 1 to 10, what would a home health agency have to score in order to be able to get your business, to be able to get your referral? He may not even need a 10. He may need a 7. Great. Appreciate the fact that, doctor, you said they need to score a 7. What do I need to do to be able to score a 7? That type of question will literally bring up to you why the physician needs home health agencies. That type of questionnaire, that type of engagement will literally have the doctor tell you what's important to him. Is it important for him that the home health agency have a good follow-up? Is it important for him that the agency works well with the laboratory? Is it a good thing that the patient actually reduces the readmissions to hospitals? Each doctor is different, okay? And you need to be able to know those. Do you have 5 to 6 different scripts out there that's ready for you to use as closing within your presentation? Okay, so these closing techniques are what we use to be able to ask for a referral, because you'll be surprised how all of a sudden you may get a referral right there and then. But if you do not ask, you will never ever get a referral. Or one of my favorite ways to ask is to get a commitment. Has anybody asked you, I would love your commitment? Has anybody ever asked that of you? So try this. When you're doing your presentation, one of the quick, what we call the commitment close, is literally this: doctor, I would like to be able to get your commitment to be able to make sure that you give us a call once you have a patient that's available. Let me ask this, doctor. At this moment, can you commit? Do you have a patient right now that would need our services right now? What you're doing here is you're planting the word commitment in their head. And if they can literally even just nod their head that they commit, or even better, if you can actually get them to say the word "I commit" to you to be able to send you a patient. These are little quick techniques that you need to be able to add to your presentation. You'll be surprised how you can actually increase the chances for you to be able to get that referral. Okay, so problem number 2 is this, is that you don't prepare. Okay, do you guys actually prepare? Do you guys have actually scripts ready made? Do you have an opening? Do you have your questionnaire? Do you have the body? Are you also actually going to literally summarize what you just discussed with them? Okay, and then you want to be able to, remember at the end, ask as well. Okay, do you have a presentation script that is ready? That literally, if I walk into your office and I meet you for the first time and I tell you, you have 5 minutes, sell me your services. Can you give me a presentation? What we do is we work with a lot of companies and we give them a 3, a 5, a 10, and a 15-minute presentation technique. They need to be able to do that because before you start a presentation, has anybody ever walked into your office and they create a meeting with you, or they just walk into your office out of the blue, right? What's the first thing that's in your head? Here's this person bothering you, taking your time. The first thing in your head is, when is this gonna end? When can I get rid of this person? Okay? It goes the same exact way. They're busy. Here you are trying to take some minutes, some hours away from them. Find out, what is their time limit? It's what we call a false time constraint. So if you are able to know right away how many minutes they can actually give you, then you can schedule your presentation that way. By you being able to acknowledge that, it makes you look good. It makes that person feel that that the minutes, their time matters to you. So give us a call. We'll give you the quick, the quick 2-question ways on how to be able to get your false time constraint and how to be able to handle that when a person's saying that I'm busy right now, I don't have any time. So if you want to be able to know that quick script, go ahead and shoot us an email or ask us a question. We would love to be able to hear from you. Okay, so we'll talk about preparation, right? You need to be prepared. You need to be able to make sure you have everything with you. You want to be able to make sure, here's one thing. Make sure you have a business card. When you go into presentation, the first thing you check in your pocket is, do you have a business card? Never ever walk into any presentation if you don't have a business card. Right there alone, it shows you're not prepared. If the other person doesn't have a business card, perfectly fine. But you as a marketer, you as somebody that's presenting your company, you as somebody that's actually representing your company, should always have a business card, even in your day off. I make it a thing where I actually have extra business cards in my pocket. I have business cards in my wallet. I have it in my bag. I have it in several of my cars. Because the reason why is, anywhere I am, I'm going to need to make sure I have a business card, because you'll be surprised where you're going to meet somebody that may give you business, that may give you referrals, that may introduce you to somebody else who can give you referrals, okay? So preparation is very, very important. And, what I want to do, here's a quick quote that I love. It is better to look ahead and prepare than to look back and have regret. Do you want to be able to have regrets? No, you don't want regret. Nobody wants regrets, right? It's the worst thing to be able to experience. And this is very important for you guys. Don't regret things. You're like, I should have had my business card that day, or I should have been better at my presentation. I should have prepared myself. Look, prepare now. You need to be able to make sure you prepare things. All right. Problem number 3 is what we call, it's pretty much part of the whole preparing. It's training. Okay. So let me ask this question. You have nurses working for you. You have caregivers working for you. You have therapists working for your company. You have your staff members in the office that are ready, right? That they do their job. So what do? When we meet these people, we train them. And we also have our constant CEUs, your continuing educational units that we require our employees to have. We also have our in-services that is required of them. Now let me ask you this. When's the last time you actually have a real training in service with your current marketer, with your current marketing team, even your director of nursing, even your administrators, even your bosses? They better be training as well. When's the last time you guys trained with each other and had a training that actually is beneficial to able to help you guys out there? When's the last time you went to a seminar? The fun part is this, is when's the last time you went to seminar and how long did it take you to not do what you learned? A lot of people go to these seminars and then all of a sudden what they learn is they don't actually apply it. They say, oh, that's a great information. We're going to actually implement that. Then all of a sudden it never happens. You need to be able to constantly train yourself, drill your staff, and rehearse continuously to be able to be ready on what you're going to be facing. And that's, something that we do with the Home Health Success University, where we have over, 300 hours worth of training to be able to prepare you guys to what you guys are going to be facing out there. Be able to face objections, to be able to face, certain, constraints that are happening out there, to be able to know what you need to learn. Because if you don't know something, that may put a pause on you trying to move forward and get that referral. You need to be able to educate your staff. Just like your nursing department, just like your caregivers, your team that actually goes out there that presents your company needs to be also trained in marketing and trained with the new different ways of how to be able to stand out. And so training is so important to be able to have. So make sure you guys have a training regimen. And if you guys need a training regimen, I'll be glad to be able to help you guys and progress you guys on your way to be able to have the successful, team, the marketing, the liaison team out there to be able to give you guys more referrals and increase your census. And, so we talked about asking for a referral. We talked about preparing. We talked about training. What's the next thing that we need to talk about is act. Create action. You want to literally just go out there and do things right away. You need to be able to look. A lot of times is this that, we have a lot of what we call procrastinators, okay? Are you a procrastinator? I know I am, and I have to check myself. I have employees of mine that will check me when I'm actually having problems or when I'm doing things. And so what you want to be able to do is this, create action. Create a plan, right? You plan, you train, you act. You go out there and you market. Just because you get an objection, who cares? Look, the world is full of objections. Gravity is objecting us right now, right? If gravity wasn't here, we'd be flying everywhere. We're not restricted. Look, it's okay to have objections. People are going to object with us, but if you act more than the average home health agencies out there, you're going to get more referrals. If I ask you right now, how many physicians did you visit this week? How many nursing homes did you visit this week? How many doctors did you actually call today? How many hospitals have you sent letters to today or this week? You want to be able to make sure you act. When you have a plan, when you train for it, big difference is to act and to do things now and create action and actually bring in results. You're not going to be able to do anything if you don't go out there and implement what you learned, what you guys decided as a company. We're going to be able to help you guys create a marketing plan. We're going to be able to help you guys, plan your week on how to be able to target certain things. But those are all easy to do. And even the planning and implementing is hard already as it is. And that's what we're here for. But the action. And so for us to push you guys out there, and that's what our goal is to be able to show you guys what are the differences between the successful agencies and the ones that are not succeeding or are stagnant. And so you want to be able to act, create action, do now, not later. Don't be worried like, well, what if I make a mistake? Well, you know what? Everybody makes mistakes. But learning from your mistakes is what's most important thing that you guys need to do. So create action, go out there and actually implement what you've learned. But of course, you want to be able to make sure you have the right things with you. So what we do again, we talk about the action. We talked about your preparing, your training, and to what? Ask, okay? So if you guys can see right now with this presentation, I told you what you guys are going to learn, and right now I am constantly what? Telling you guys what you have learned. What I'm doing is I'm implementing to you guys, I'm repeating to you guys to be able to help you guys put it in your brain, to be able to put in your mindset, to be able to what? Use what you're learning to create action. Because what I want to do is I want to get your commitment so that you guys can actually start having the success that you guys deserve. Okay? Henceforth, commitment, the success. I want you guys to commit to success. Get it? All right. Here is, now let's say you trained. Let's say you prepared. Let's say you acted and presented. You're out there. And let's say you went ahead and asked for that referral. You did all that. you're going to increase more chances for you guys, because the more you guys go out there, the more you expose yourself. If you actually ask for a commitment and you start asking, you might increase the chances of you getting more referrals. Now, here is the fifth biggest problem that we do why we don't get referrals. Okay, so the fifth one is we forget to follow up. Okay, so let me ask you this. You visited a physician last week. When was the last time you followed up with a physician? You visited a physician a month ago. When's the last time you followed up with a physician? How fast did you follow up? What did you follow up with? Okay, what mode of transportation did you do the follow up with? You want to be able to have a follow up program, okay? And a lot of agencies are going to say, well, you know what? We did a great presentation. I'm going to follow up with them next week. Wrong, okay? That is wrong. It's like a friend of mine, okay? He met this girl, beautiful woman, and what was funny is that they went on a date, okay, and they had an amazing time, okay, and what ended up happening is that she didn't call him no more, and I said, well, did you follow up with her? And he says, well, I wanted to give her 3 days, so that we can have, so she can remember and just, give her some space and everything. And what ended up happening was what? Calls her up 3 days later, right? And she's on a date with another person. And this person she ended up marrying, okay? And so here is a quick example, just a simple example. I know it's off the topic, but, where follow-up is very important. Don't wait 3 days. Don't wait a week, okay? Do you have a follow-up system? I make it a habit that I follow up with a client that I did a presentation to the very same day. Very same day. If I have your cell phone by the time I left your office, guess what? I'm going to be text messaging you saying thank you for the appointment. Okay? I even have my team in the office where after I do an appointment, I will call them up and I say, look, send them the number 1 fax. And they'll send them a fax that they already know what is the number 1 fax, and they just add the person's name and a few details if I want to add things to it. You need to be able to have a follow-up process. Do you have a follow-up process? And what we do is we teach people a 20-point follow-up system, where the moment that they actually had a presentation, that there is 20 ways that they need to follow up within that person. You want to be able to create that brand. Okay, so a lot of these companies, if you actually watch commercials, when before you even start using a certain product, you've seen this product constantly out there. It is very rare that we see something for the first time that we actually create action and actually use that or buy it or go there to that restaurant. A lot of these people, they will slowly introduce a variety of different ways of follow-up. You're going to see them in the internet, you're going to see them in the TV, you're going to hear them in the radio, you're going to hear them in your emails, you're going to hear people talking about them. What follow-up system do you guys actually have to increase your referral chances so that they, will always remember your name and associate your company's name with the services that you guys offer? Very important to be able to have a follow-up system. So if you are able to create an amazing follow-up system, to be able to make sure you create action, you be able to make sure that you train your staff, that you actually prepare things, and you make sure you keep on asking. And part of the follow-up is it's literally asking them continuously to be able to use your services. Very, very much important. Now, I know I told you guys that I will share with you guys literally 5 different things of biggest mistakes people make. And those are the things. Are you making any of these mistakes? Can you improve any of these mistakes that you're making right now? Can you increase the chance of you getting more referrals? Of course you can. Of course, there is always room for improvement. And I want you guys to be able to use this quick video to be able to see that, we do need some work. We do need to be able to adjust in certain ways to be able to, increase the chances. So just to let you guys know, my name is Michael with Home Health Success Academy. I just want to say thank you so much for, watching this quick video of ours. Our goal is to be able to help your company create more success, to be able to have the company that you guys deserve, okay? And so if there's any questions that you guys may have, please send it over to us here at Home Health Success Academy. I just want to say thank you so much. Our goal is to be able to help you succeed. And remember, home health marketing is not hard if you know what you're doing. Don't forget to visit homehealthsuccessacademy.com. if you've seen this video through like our other sources, like in our website, or seen it through LinkedIn or Facebook, or through Google Plus, why don't you guys go ahead and go to youtube.com and enter home health marketing at the top, and I will guarantee you the first 5 or 6 pages, it's blanketed with all my free videos to be able to give you guys some amazing training. And what I want to do is I want to be able to challenge you guys to do this. We have our Home Health Success University. Crazy amount of information right there. That is for some of our diehard subscribers that want to be able to get that successful company that they deserve. Remember, we also have our live events that is coming to your city, where we literally are there to be able to help you guys create success. Typically when people ask me to do one-on-one with them, they charge, I charge $5,000 for me to come to a facility and to be able to work with their staff one-on-one. When we come to your city, you're going to get the same information from me that I'm going to be able to share with you guys, for a fraction of the cost, for $2.99 for one full day, for me to be able to give you guys so much amazing information. So look out for those dates in our website. And if not, if you cannot attend those days, we actually have our virtual training, our virtual training where we give you the same information that we do in our live training direct to your door, and give you a 3-day pass to be able to watch all the videos that we do, that we share with people in our live seminars. So, I want you guys to make a commitment and create action now to do something. If the free things that I give you guys, the free techniques, is able to help you guys, please use them. But my goal is to be able to make sure that I actually create an impact by working with you guys one-on-one through our seminars, through our university. Because the more you learn, the more you prepare, the more you train, and when you act, and we will help you act, you're going to become more successful. You're going to receive what you deserve. What you want, what you need is going to be granted to you guys because you created action and you're doing something in your life. So thank you so much, guys. Once again, this is Michael from Home Health Success Academy. Just signing out. Thank you so much. Give me a call, 630-340-8990. We're all over the place. Have a great day.